Hey everyone, my name is Alan. I'm with Impetus Physical Therapy. Today I'm going to talk about anterior hop downs from a step or from a box. There's a fair amount of research available out there that shows that common knee injuries that occur in cutting sports like soccer, hockey, basketball occur from a lack of hip control that changes the way the knee functions during activities. By making sure that you have strength in the hips and that you recorrect motor patterns, these injuries are very much so avoidable by giving your knee a little bit more stability. I'm going to show you an activity today that is both great for developing strength and retraining those motor patterns so that you can reduce your risk of knee injuries. So again, this is a forward hop down, and we're going to be talking about the knee and hip mechanics as we're doing this. You'll want to start from a lower surface, so today we're going to start at an 8-inch step, which is about a standard step. We're going to have our feet about 5 to 8 inches apart, and when we come down, we need to look at our knee mechanics in two different places. The first place is that eccentric bounce before we leave the step. So when we go like this, right before we hop, we need to make sure that our knees are staying directly over our second toe. So that's something you can kind of get used to. Use your eyes to make sure it's in the correct position, and then get used to what it feels like. A bad behavior that we would want to avoid would be medial collapse, or letting the knees come in towards the midline or away from the feet. That would look something like this. So if you do that when you jump, that could be something that leads to a lack of hip stability and a higher risk of knee injury when you're doing these cutting sports. So we're going to get used to that first phase, what it feels like. And then the second phase, we want to make sure that we're absorbing shock very much in the same way. So when we hit the floor, do our knees stay directly over our feet, or are they going in or out? Again, we want to use our hips to stabilize our really strong quads to avoid movements that look like this. Those are the types of movements that put a lot of torsional stresses on the knee joint and can result in simple injuries like an ACL or meniscal tear. I'll show it to you one more time. So again, pay attention to the first phase before you jump. Make sure the knees stay above the feet. Get used to what that feels like through the quads and hips. And then the second phase is hopping down and absorbing the shock, again, straight line. Once you're able to do about 10 or 15 of those with great mechanics and familiarity about how that movement should feel, then you can slowly progress to a slightly higher step. So now we're at about a 16-inch step. We're increasing the forces, we're increasing the load on the hips. And then gradually you can also work on a jumping up. All right. Thanks for watching. I hope you learned a lot today about knee stability and hips. And good luck to you on the court or the field.